All right, thank you so much for joining us once again. Our sign language interpreter tonight is Rhoda Nyamai. To start us off, Population Services Kenya has launched its report after the completion of the Accelerate program conducted in the counties of Narok, Kwale, West Pokot and Garissa. Some of the key findings include facility readiness to offer integrated SRH and GBV services, as well as increased adoption of modern contraception in hard-to-reach communities. Elizabeth Atieno with the details.
736 million women and girls in the world are affected by gender-based violence. In Kenya, 34% of women of reproductive age have experienced physical violence since the age of 15. Additionally, 13% of women have experienced sexual violence, while 7% of women have experienced violence in the past 12 months.
Looking at the data collected for this midline assessment, we saw 17% of men are now coming out to report, as opposed to what we see in the baseline, where only around 1% were reporting.
Intimate partner violence is still on the lead if the 45% GBV cases reported is anything to go by.
We've seen that facilities do not have dignity kits. Therefore, when GBV survivors come, they are forced to stay in the same clothes that they have been violated with, and they stay with that throughout. Yet this is a simple kit that could be provided by the healthcare facility. On a positive note, there has been a steady decline in female genital mutilation. However, despite the grave health consequences, FGM is still practiced in some geographies in Kenya. Many residents from Narok and West Pokot believe FGM practices are driven by cultural norms. We've seen that there are alternative rites of passage that have been provided by some communities, where communities are opting for other ways instead of the traditional female genital cutting.
As of now, 1.4 million Kenyans have undergone FGM. FGM is not the only health threat among women. Every year, 5,500 women die during childbirth. Child marriage is also an issue, with data indicating that 23% of girls below the age of 18 have been married off.
The strategic priorities that are defined in the national guidelines, in the policies, a lot of times the Ministry of Health will define a strategic priority, a strategic guideline, but they may have challenges in terms of the resources to implement.
More than 40% of women do not have access to modern contraception. However, stakeholders insist it is worth noting that there has been an increased adoption of modern contraception even among the marginalized communities, despite social, cultural and political interference, as well as male opposition. The report has been released by the Population Services Kenya following the completion of the Accelerate program conducted in the counties of Narok, Kwale, West Pokot and Garissa. Elizabeth Atieno, TV 47, Nairobi.